Good morning, Commissioner. Susan Wheelan, Public Health Director for El Paso County. I am so grateful that we are able to take the time, and you are able to take the time to recognize National Public Health Week. We were in a very different situation last year. National Public Health Week happens every year, and we do resolutions or proclamations, and we like to have celebrations, usually for public health and the work of our team. So we are doing a few of these proclamations, but I did want to say a few words, if it's okay with you all, as a refresher, and I know that there are others that are listening online. Our agency was the first accredited health department in the state of Colorado back in 2003. We became the second reaccredited health department in the state of Colorado in 2020. And that shows and demonstrates the excellence for the standards that we meet. It's not all about infectious disease prevention. We do so much more. And I understand that that's where our priorities need to be, and that's where our priorities are. Right now, all of the energy is going into the vaccine rollout, but I do want to acknowledge, and you all know, that it's much more, as you talked about, Commissioner Bremer, in our mission. Our mission is to create the conditions with the public health system, which is much more than the health department employees, create the conditions in which every member of our community can obtain optimal health. And that's not just from disease prevention. It's acute diseases, it's chronic disease. We know that mental health and physical health cannot be separated. So public health and the public health system is so much more than the health department, our team. And Commissioner Williams had earlier thanked the entire county team, and I would echo that because it's part of the public health system. We cannot do our job alone, and you know, as we've been focusing, that we have been taking a holistic approach with everything that we do, including businesses, schools, restaurants, seeking so much feedback, and through the partnerships and collaboration, determining what the next steps forward are. And we've made tremendous progress together, and we need to keep it going. And so I'm incredibly proud of my team. We have 158 steady full-time employees. We've ramped up to 200 communities our size with populations of over 722,000 on average have 256 full-time employees. So you know that we are efficient. We have a lot of dedication, expertise, and throughout this past year, my team has not skipped a beat. We have stayed steady. We have stayed focused. We have not been distracted from a lot of what has been going on or said about maybe misinterpretations or misguided anger towards local public health and what authority we have or not. But I just wanted to make that point because my team, I can't tell you how incredible they are, working 24/7. They are so dedicated. You enter a field of public health because you want to help people, not because you want to shut down people's livelihoods or do any harm. And I think that we were able to have a few of our team members here, epidemiologists, make up our team, medical doctors, communication professionals, public health nurses. We have a lot of different expertise, and hopefully we can take a photo here later. I wanted to read just a couple of comments or snail mail that I get. I will tell you, I appreciate opening the mail these days because it hasn't always been this way. I mean, there has been a lot of elevated anger. There has been lawsuits. There has been, it's been grueling. So when I open the mail these days, I still get kind of a reaction like, what is this going to be? And we'll address it. But I want to take the time only to read a few samples of what I'm receiving through snail mail and also through electronic mail that shows you that throughout El Paso County, people appreciate the work of local public health, in addition to all of our other great first responders and healthcare providers and teachers. But I do want to take the time to provide a little bit of this. And I just know from the postage of where these folks live, if that's their address, and this is the one I believe that is in your district, Commissioner Geithner. Dear Mrs. Wheelan, I wanted to tell you about my experience at the vaccination clinic at El Paso County Public Health South. I could not be more impressed with the organization and professionalism of everybody involved in such a huge task. I am a retired Los Angeles police officer, and I have spent a career working with the health department, social services, fire departments, and a host of other government agencies. What I observed firsthand at the clinic from everyone involved was second to none. I cannot tell you how much I appreciate the sacrifice that your department has made over the course of this pandemic, not to mention the risk that each of you has faced in the course of your duties. I wish I could individually thank everyone involved in all aspects of the vaccination clinic. I would also like to acknowledge Marini Klaber, she's a regional epidemiologist with our agency, who I can genuinely say has the best interest of the public at heart. I know Marini would be a valuable addition to any organization, and I feel you are lucky to have her in yours. Again, thank you for your organization, for everything that you do. Sincerely, and I won't mention the name, but because they're sending it personally to me. Another one. Dear Mrs. Wheelan, I am writing to laud you and your team. Thanks for you and your highly professional team. I experienced a flawless, which is underlined, vaccination process 3/7/2021. I'm sorry, 2021. Sign up, directions, follow up, well-staffed facility and fountain. It was quite hassle-free. Kudos to all. Thank you. Thanks to that, and she's appreciative that she got the J&J, and then she's telling me a little bit about her experience that she's well aware of the intricacies of the operation. I sing your praises to all, sing local public health praises to all. If I can ever be of service, please call me, and she has her information there. And just a couple more. Received an email from one of our AMR vaccinators, because we utilize a lot of volunteers at our points of dispensing. An AMR vaccinator said that this was the most organized of any she has been to or has served in, and this person has worked all over the state at these points of vaccinating. So that just tells you that the clinics that we run are very much appreciative, and these folks that have experience are complimenting. One other comment, Miss Susan Wheelan, I want to let you know, Lisa Pals, she's our regional, she's our emergency preparedness and response manager. I want you to know that Lisa's efforts in getting vaccines for the elderly at our church went above and beyond the call. We have an 80-year-old woman who had tried for 2 days to get an appointment and was unable to navigate through the maze due in part to her limited computer skills. My wife worked with her for about 2 hours and was unable to get an appointment. When I called the county health department, I was put through to United Way 211. I was told to try the same organization we had been trying. When I said I wanted to talk to someone from the county health department, she said she could not give me their number, but I would have them contact me. When she hung up, I had no expectations of getting a call back from the county. Lisa called back within an hour and said if we can email her a list of names and phone numbers, she would contact them. She also contacted me later in the evening. Besides the 80-year-old woman, Lisa also helped 3 other elderly, included in the list provided to her. Appointments were set up for the next couple of days, a job well done. Thank you for hiring such dedicated people as Lisa, and please give her, Lisa, our thanks. And this is just a sample, and my folks go above and beyond to be a service to the public. And I want, you all know that. And I want more members of the public to know that may not be familiar with local public health, because the team of public health that we have is incredibly beneficial to the health of the entire community, and not only in a crisis response for the pandemic. So thank you so much for taking the time to celebrate with us a little bit. I do think that that's important when we work so hard, that we need to have some celebration and lift us up and keep on going, because we have a lot of work to do, but we've made tremendous progress, and that is going to continue to accelerate. We are going to get continued increases of vaccine supply, and we've closed the gap of the vaccine shortage, and so we're going to accelerate, and hopefully we'll be able to open another mass vaccination site up on the northern side of Colorado Springs, El Paso County, to serve that public. Because what is interesting to me is that with the mass vaccination site at the World Arena, they're doing a tremendous job. They're not all county residents, El Paso County residents. And so when you look at the numbers, we need, and we have been expanding, we need vaccination sites throughout El Paso County. We have nearly 100, but since we have the largest population, we need more mass vaccination sites so we can accelerate our efforts, because we talk about it's a race against the variants, and we need those resources. So I will take any questions, or if any other members of my team would like to come up here or say anything, I welcome you to. And again, thank you.
Thank you, Susan. And I'd like to also make that offer for other members of the public health team, if you'd like to come up and say a few words.